How to recognize childhood TB symptoms. Imagine trying to spot a quiet sign that your child might be unwell in a way that's not always obvious. Tuberculosis in children can hide behind subtle signs, so knowing what to look for is important. Most childhood tuberculosis affects the lungs, but it can also involve other parts of the body, making symptoms vary. A common sign to watch for is a cough that lasts 3 weeks or more. This isn't just a little cough. It's persistent and may not go away with usual cold remedies. Along with that, children might seem more tired than usual, feeling weak or lethargic, and they might not want to play as much. If your child is losing weight or not growing as expected, it could be a sign of tuberculosis, especially if combined with other symptoms. Fever is another key indicator. It might come and go or stay 4 days at a time. Night sweats are also common, where children wake up soaked in sweat without any obvious reason. Loss of appetite is typical too, so children may refuse food or eat less than usual. In infants or very young children, symptoms can be less specific. They might appear sluggish, irritable, or have trouble feeding. Sometimes, if tuberculosis affects the brain, known as tuberculosis meningitis, symptoms can include a bulging soft spot on the head, vomiting, or signs of increased sleepiness. When tuberculosis affects parts of the body outside the lungs, symptoms depend on the area involved. For example, swollen lumps under the skin could be a sign of lymph node tuberculosis. Blood in the urine might indicate kidney involvement. Back pain could suggest spinal tuberculosis, and hoarseness might be a sign of voice box infection. Because these signs can resemble other common illnesses, it's essential to consider risk factors. If your child has had recent contact with someone with active tuberculosis, lives in or has traveled to areas where TB is common, or has a weakened immune system, the chances increase. If you notice any of these signs, especially if they persist, it's very important to seek medical advice promptly. Healthcare professionals can perform tests to confirm if tuberculosis is present and start appropriate treatment. Early detection is key to managing childhood tuberculosis effectively and preventing serious complications. Remember, every child is different, and only a healthcare provider can give a proper diagnosis based on a full evaluation.